The broadcast is now starting. All attendees are in listen-only mode.
Hello. How's everyone? We'll get started here in just a moment. All right, so hello to everyone. Thank you for joining us for the Risk and Safety in the Time of COVID-19 webinar. My name is Shaun Hayes. I'm the Risk Manager at Tandem HR. Before I begin, I just want to take care of a few housekeeping items. Please note that all participants are going to be on mute throughout the presentation. I'll be reviewing all the questions received during the registration process. However, if you have any other questions throughout the presentation, feel free to submit them, and I'll try my best to get to the questions. If I'm unable to answer your questions during the presentation, I will contact you directly with an answer. So one of the things I was mentioned is Risk Expert. I appreciate the compliment. One thing that I try to do, I do have a long tenure working in claims and risk management, but one of the benefits of working in claims and risk management is I've been able to have a number of resources and experts that I can reach out to in order to do my job properly. So why don't we get started? I know we're living in this surreal time, and I do ask myself if this is real life. And I guess we're all having to play with the cards we're dealt right now. So I think there is a light at the end of the tunnel, and we'll get there. It's just a matter of when. So just a little background about myself. I did start my insurance career at Travelers Insurance. I worked as an adjuster in all 4 major business lines. That included auto liability, general liability, property, and workers' compensation. I worked as a claims advocate and as a consultant on the client as well as the broker and agency side. And I've worked in risk management on the captive level. And now most recently, I am here at Tandem overseeing the risk management for our PEO clients. So we'll move over to slide 2. So this will just cover the objectives. I'll cover a little bit about an occupied office, working virtually, coming back to the office, the infection mitigation, and then some jurisdictional workers' compensation and the Q&A. All right. So for an occupied office, we really are seeing another surge of COVID-19, and so this puts the business back in the position of potentially closing the office down. I think it's important. I think you guys may have familiarity with closing the office down. We've been established in kind of this pandemic for the last several months, but I think it's good just to have a refresher. And a lot of these items are common sense. So, may not be something that is, brand new to you, but I think it is important. So when you're covering the office closing down and managing that process, I want to touch base on the virtual work and returning to the office, but this is kind of the first step, right? So there are times when the office is closed and you'll have that location closed for holiday reasons on a temporary basis. So this is something you obviously can be familiar with as well. So one thing we want to look at is the property protection. If we don't have an employee present at the location, that can delay identifying issues with the building or office. So if there are electrical issues, maybe there's building and heating issues as we enter the fall and winter, having that early identification is critical before any of that potentially serious property damage can be an issue. So you just want to arrange for the unnecessary utilities and equipment to be turned off. Have a competent professional or competent employee who does or performs those tasks, and have them follow those normal shutdown procedures. One thing you want to do is just arrange for utilities and equipment needed that protect the building itself and the contents that are in your building. So maybe that's even outside lighting. Again, I mentioned building heat during those cold weather times, or refrigeration. You may not be using that, but just accounting for those perishable goods. If you have alarms in service, confirm they're in proper working order, and make sure the building is secured. Exterior doors and windows should be closed and locked, and then make sure your fire protection systems are in proper operation. Excuse me. So when you're maintaining the monitoring of your location, just make sure that you're using either your monitored alarm systems, fire alarms, intrusion alarms, and if you have a guard service, and you have a guard present, maybe that's something where you would have for guard service consider more frequent tours. Locations with monitored alarms, maybe assign a person to visit the location to conduct that daily tour. And then just, again, guard service, maybe just do more frequent tours just to follow up. Really the purpose of the daily tour for monitoring those alarms, if you have an alarm system intact, is have a person visit all the building areas, detect abnormal conditions, and then if they have to notify management, or if you are management, you're made aware of that, and then you initiate the corrective action. If you want to verify, again, any unnecessary utilities and equipment, make sure that they've been turned off. And then always make sure that you have a qualified professional to turn on utilities or restart your processes. So if that's for lighting and gas, electric, maybe you have an electrician, plumber, or you have any professional equipment operators. But just make sure that you have your ducks in a row. You're using a professional to properly shut down those items or reinitiate them. So the following risks, they can be mitigated while your office is shut down or working at that limited capacity. There's going to be that risk. So when it comes to theft and vandalism, unlawful occupancy, it can be avoided or mostly avoided just by having security or an employee present to check on the contents of your building, of your office. Based on your operation, you may want to establish a skeleton crew just to maintain any of critical equipment you have based on the type of business you run. So you may have somebody already in your office that's kind of overseeing things, but if you have vulnerable equipment or items that need to be handled, then you may want to have that skeleton type of crew. Just make sure you have your building safeguards in place to protect against those natural elements. For the equipment, make sure you have one of your professionals, again, periodically check or hire that professional to check on it. So if you have HVAC equipment, anything that just, even the common equipment, maybe have a professional, make sure everything's in proper working order while you're out of that office. So what I also want to cover is working virtually. I think probably half of you, or maybe more, are working virtually. So this might be old hat to you and something that you're already familiar with, but it's something you have to take into account. And as you have new employees are hired, maybe they start virtually directly, or if this is something that you were maybe keeping the office open, now you do need to go to a virtual workspace just because there's a surge in COVID and there's concerns about the office being open. Maybe you're in a hot geographic location. So when it comes to working virtually, again, this is items you might know, but select a location that can be permanent. Make sure you have a comfortable temperature, adequate noise levels, there's enough space for you. Make sure you have suitable space for your equipment and your files. Just ensure that space you select won't disrupt your household. That's really important. Workers' compensation claims can still happen when you have employees at home. So the last thing we want is for somebody that is working in their kitchen to stand up and they trip over their dog or bump into a running child that may be home working via e-learning, and suddenly you might have an exposure for a work-related injury. We just want to make sure you are, quote, at work and you or your employee is focused on their job. So just make sure you have privacy, i.e. a door, and ensure that your space has, obviously adequate cell phone or Wi-Fi reception. If you're working out of your basement, make sure that you have a good connection, because sometimes if you're doing video calls or just even working on the internet and you're working off a router, that can be a problem. You may not have that proper reception. Just make sure, again, you have, when we talk about adequate power supply, you have adequate electrical power available, your wall outlets, your power strips should be accessible and not overflowing. Also, look at your office decor. If let's say you have your office, make sure you have an appropriate background. And in case you're doing any type of, let's say, Microsoft Teams meetings or Skype or any type of video chat, most of these programs have virtual backgrounds you can include. And the last thing you want is for maybe you or your employee to become a meme. And, I'm sure some of you have seen those goofy TikTok videos where they'll play that, I don't even know what that's, like, da, 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 and it's a person dancing in the background, or they have, they're wearing a costume, and hey, we're at Halloween time, so you might see more of those. So just make sure that if you can, you keep the background professional, or you can use that virtual background. The other thing is you just want to maintain that same work schedule you did while working in your office. Consistency is always important, so you want to keep that schedule as consistent as possible, and it'll help you keep you in a rhythm as you work from home. So another thing we would talk about, obviously, would be ergonomics. You want to prevent any discomfort. Maybe you don't want to sit on a couch or a coffee table, TV tray. Maybe you don't want to work on your floor for your work activities. So these are options that obviously wouldn't be favorable to creating that stable work environment. So, select a chair and a desk, with a work table combination, something that's similar to your office if you can. Some of you might want to try out, we just had an employee of ours do a standing workstation. Maybe that's something where you want to try that out. Keeps you healthier. There's been a lot of valuable research that shows that it's better for not only physically, but your posture. And so other things that maybe you can try at home that you don't necessarily get to try at work. You may not have that opportunity to do that. So something to look at. Just make sure you have enough room to spread out. So your workspace should have enough surface area, obviously for your computer setup, cell phone, documents, files, paper shredder, whatever. Make sure you have enough counter or cabinet space available in your office. And then just make sure you select a monitor that you have a comfortable position with, brightness levels, all the basic information. Make sure you have kind of things that you take for granted while being in the office that may already be set up for you. These are items that your employees or yourself have to account for, and you have to set up on your own most of the time. So, there's that continuous comfortability factor, and if you're hunched over typing on a computer, that opens up a can of worms for concerns with even carpal tunnel, or just discomfort that can happen over a long time frame. And I think for a lot of us who've been working from home for a significant amount of time. So you don't want to practice bad habits and, maybe create an arched back or, have something that can create issues with your, your upright position. So the other thing you want to look at, we have hazards while working from home. So you are going wireless, that's definitely the best way to keep some of those hazards away. Make sure that your keyboard, your mouse monitor, if you can get it all wireless, great. Bundle and move your cords and cables away from walking areas, your working areas. You don't want to have any hazards, things that you can trip over. Don't overload your electrical outlets. Try to keep the clutter under control. If you have a lot of files and desk items, make sure you're not blocking heating and air conditioning vents, any type of potential fire hazard. It's something stuff that maybe not happen, but you just, if you're not working from normally, you just want to make sure that you're keeping things as efficient as you can. If you have any types of floor issues, loose carpeting, gaps in your floor, uneven surfaces, your lighting and visibility is good. Make sure that you have, proper lighting and visibility. You want to trip over something. Again, these are all potential injuries or potential workers' comp claims that could happen if somebody gets hurt while they're working. And just make sure that if you have employees that are working from home, the home cyber systems are more vulnerable to that type of attack, and so than what you would have in your office, obviously. So especially if your employees are not on the company intranet, then they're going to be more vulnerable. So just employees need to be aware that their Wi-Fi system, the internet connections are secure, they're strong. They have proper passwords and firewalls. And then the other thing is, when all your employees are working, you want to make sure they're keeping to the company equipment, just keeping to the business related tasks. So, they're using your laptop, they're using their laptops or their company equipment for work related activities, not just going to some questionable websites or, checking their fantasy team, things of that. Slide 9 here. My computer is freezing out. Okay. Bear with me. There we go. So returning to the office. One of the biggest obstacles anyways, is running our operations in COVID-19 and getting our employees back to the office. So the question is, what can we do to protect ourselves? While still finding an efficient way to keep our business continuity. And you need to have that understanding. I think it's important having understanding of your company's physical layout, what your operational activities would be. If there's a community spread, you need to be aware of that geographic location. If maybe you're suddenly in a hotspot, if your office is in a hotspot, things that you need to be aware of. Or if you have employees that are in a hotspot. So these are all items you need to look at. Just understand that the level of community spread, and then if necessary, you can absolutely work with your local health department, local health organizations, and they can keep you apprised of how things are progressing within that regional area or within your town or location. If you don't feel comfortable with the geographic location, again, encourage employees to continue working remotely. This isn't something you have to do. If they're operating efficiently and you guys are able to continue operations, then have them continue to work remotely. It's not something necessarily, if you can control it, control it. Now, an example of that would be field staff, your sales team. They might still be doing, client to face-to-face interaction with clients. So you may want to limit or cancel that travel as much as you can with them. And maybe that is, if they were coming in the office, maybe you keep those employees, coming to the office, maybe, but maybe on a once a week basis, whatever process that you put together. when it comes to conferences, company gatherings, those are also items that you may want to limit or cancel. So we just want to make sure that when we talk about screening practices, an example that we want to make sure you have those quality screening practices. One example would be including temperature checks on a daily basis. For any of those screening practices, you'd obviously want to maintain confidentiality if there was an employee that could potentially have some of those red flags when you screen them. But you can also utilize engineering controls like isolation screens. You could have enclosures to check each employee, or sneeze guards. There are thermal temperature scans that you can be utilized. There's a lot of technology that they've brought to the forefront. Either way, temperatures need to be taken individually and in a private space. So that's definitely recommended. And if you have employees waiting in a line, you have to account for the physical distancing, the social distancing of 6 feet apart. We want them to be utilizing PPE, gloves, face masks should be utilized. And employees who appear to have any type of symptoms, you just obviously need to account for that. So whether that's fever, cough, shortness of breath, if they arrive at work and they're distributing or displaying these types of symptoms, then we want to send that employee home immediately. We don't want to put our other employees in danger. So that goes the same for if you have customers or visitors coming to your office location. You take the same approach. If there are any red flags, send them home. You have to be cautious. You have to take extra precautions, obviously, in a COVID world. So if somebody maybe mentions, "Oh no, it's just allergies. I just have allergies," and it's a challenging topic because we're in allergy season. But if somebody mentions that, then you may have to think twice if you want to take their word, or if you do want to take that risk. And if you may just want to send them home, like, "Hey, you know what? I understand you probably just do have allergies. Not everybody has COVID, but at the same point, you just need to be careful of that." So the other thing is, when we talk about improved work practices, employees will have significant responsibility maintaining that personal hygiene. So proper hand hygiene, social distancing, just making sure you're implementing those procedures is really important. In our office, we have a rotational schedule that we implemented and actually started this week. So our office right now, we're at 50% capacity. And it allows us to keep our desks and our employees socially distanced. We space the employees out as much as possible. That's what you want to obviously keep people away. And then we also include directional arrows. So we have everybody follow one direction within the office and the arrows to lead them to where they need to go. That way people aren't necessarily walking into each other, and you're just keeping that social distancing and taking the proper precautions. If an employee is leaving their desk, just especially because it's indoors, make sure they have a face mask to cover their nose and mouth. And so you just need to take that protective approach. You just encourage your staff. Again, if they have symptoms, have them stay home. There's no reason. They don't need to be a hero. And there was that old school mentality, "Oh, I'm sick, but I got to get in and get my work done." In the virtual world that we have now and the ability to work from home virtually, have them stay home. We don't want a hero. We want people to be safe and healthy. So, if somebody is coming down with anything, be careful. My wife was sick a few weeks ago, and we had voluntary office. We had people could come in the office voluntarily. I had planned to come in the office that week. When my wife caught a cold, I didn't want to take that chance because we had other people that were still coming in the office, and I let HR know, "Hey, I don't know if she has something or not, but I just wanted to make sure that we weren't providing if I was a carrier." Yeah, and ultimately it doesn't look like that was the case, but you just have to be careful. So take those precautions. And then again, when it comes to education, when you have employees come into the office, educate your employees about what they can do to reduce the spread. Our office has mandatory training before coming in the office, even voluntarily. We we had to issue the mandatory training for our employees so they understand the, how COVID-19, the symptoms of COVID-19, understanding PPE, and having the proper processes in place. So you want to make sure your sick leave policies are more flexible. I mentioned that if you have a sick leave policy, the most effective way is to isolate employees. Those who feel ill, stay home. Again, make sure that you just establish those policies and practices for social distancing, and make it easy for your staff and customers, and just to practice the proper etiquette and hand hygiene, respiratory hygiene, wearing the face coverings, washing their hands, having hand sanitizer. If that's something you want to hand out to your employees, our office, we gave everybody 2 dual layered masks and hand sanitizer to carry with them. But make sure they understand they need to have the proper PPE, personal protection equipment available. So as we move on here, I did want to provide some examples of signage you can put in your restrooms, in the bulletin boards, your walls. The CDC and OSHA really are awesome. They've been a huge resource, and all the stuff's free, and it's a huge benefit. When I've done my research, the majority of it really has been through OSHA and the CDC, and reaching out to our local OSHA representative. They've been so helpful. And another thing to take into account is you all have insurance carriers. You work with your loss control. Work with those professionals, because they also have resources, and they're working with OSHA and the CDC to provide these items. So this is just an example here of a simple poster provides the steps for an employee to take precautions on the normal workday. So it just shows literally step by step what they can do. This is a free poster that you can post, and then in the bottom there it says workplaceexample.com. You can put your own company website in there and put the phone number, but it's just something you can utilize, even just so an employee understands simple processes. Again, slide 11, these are examples that are provided from OSHA and CDC and the CDC. So you can post them in your office. I can provide links to, there's a number of posters and resources you can get directly through the CDC, through OSHA, and these are items that you want to keep in your, keep in your office available. This is something that's mentioned previously, but people have had concerns about if OSHA comes to inspect. They're not really coming out too much right now, and in light of the pandemic. But if you have, let's say, an OSHA complaint, somebody that comes out, just having the proper signage that's included in OSHA, and all your employees wearing that PPE, that's very important. And OSHA, really, that representative, that goes a long way, especially if they're inspecting your facility. We go to slide 12 here. So cleaning and disinfection plans. When you're implementing an effective cleaning and disinfection program, one of the critical components is to prevent the disease, the decrease of the spread of COVID-19. So the EPA has a direct link, which includes disinfectants that kill the COVID-19 virus. So this is the link. I can resend it. It's not a problem, but really important that you use the proper materials in order when you're cleaning and disinfecting. Areas to be cleaned, the frequency of, when you talk about cleaning procedures and techniques, you want to make sure that you're looking at the areas that need to be cleaned, having that frequency of cleaning. There is a guide directly with OSHA that provides complete layout of things that you can do while putting together a cleaning and disinfection plan. The thing is, it's fluid, so it's going to be up to the employer, to your business, how you want to implement that cleaning and disinfection plan. So if you have guidance from U.S. Centers for Disease Control, CDC, they indicate the routine cleaning should be appropriate for most areas. In addition, you want to make sure that you're just cleaning several times a day. You just want to have a consistent schedule. And again, utilizing the EPA recommendations for cleaning and disinfectants. Items you want to look at obviously would be doorknobs, elevator buttons, light switches, faucet handles. If you have common telephones, maybe you don't. You know, most people have their own private phone, their own desk area, but just computer monitors, mice, keyboards, countertops, conference tables. Those are all items that could be used for common areas where, even if you are in a skeleton crew or if you have half your staff in, people are still going to maybe utilize those areas. So we just want to make sure that you have a consistent schedule where those items are being cleaned and disinfected. Cafeteria tables, coffee pots, and vending equipment, maybe that's stuff that you don't want to utilize right now. Our office, we've essentially shut down the lunchroom. We're having employees bring in, their own lunch, and we're really kind of shutting down the refrigerator, just kind of in those common areas that we can control, where germs can spread. So just something to take in mind. But we're not using common public food items. Maybe if you are using a vending machine, that's going to be something that you want to keep a close eye on. Make sure that the buttons are disinfected, because obviously the spread, the virus can still live on surfaces for an extended amount of time. As far as the cleaning frequency, again, this is covered in the plan. So for more frequent cleaning, you may wish to provide disinfecting wipes to employees, have them available for shared spaces, like the conference rooms, as I mentioned, or any type of group workspace. And the EPA has those types of even disinfectant wipes you can look at. If you have janitorial staff or a cleaning service, we want to make sure they have the proper training on using any of these chemicals, cleaning agents. Just make sure that they have that proper training. If you have any type of written service agreement, one thing you just want to really 4 things you want to make sure of that it's focused on: areas to be cleaned and disinfected, the materials to be used, the frequency of the cleaning, and any material-specific cleaning procedures, techniques, what they do. If you can have that in your service agreement, that's something that you may want to look at doing. And most cleaning companies understand that process, and they'll work with you. So this graphic really just provides a visual understanding of the symptoms of COVID-19. Again, you just want to make sure you understand. These are the basic symptoms you look at: shortness of breath, difficulty breathing, fever, chills, body aches, all the common signs. And again, it may not be COVID, but these symptoms can commingle. But obviously, if anybody's sick, you don't want to come in the office regardless. One of the key differences maybe would be the new loss of taste or smell. So when it comes to positive infection mitigation, if employees are symptomatic, you obviously, again, in that situation where somebody is symptomatic and has that, could be, there's a concern that they might have COVID or those symptoms, send them home to seek medical care, quarantine, just make sure that they are sent home, and then implement and investigate, if you can, any type of contact tracing within the office. It's not something necessarily where you have to follow HR guidelines, and you want to make sure that you're keeping it under privacy. But if it's your risk manager, your HR manager, you just need to verify this employee, if he or she may have had close contact with any other employees while on their job, who they've been with during the past week. Did they have any type of close conversations, meetings, lunch, any coworkers? These are things you probably need to know, because you have to mitigate at that point. And anybody else working in close proximity with them. For the CDC, per the CDC, if you look at contact tracing for anyone who was in contact, then typically an infected party is somebody that's could be greater than 15 minutes of that close proximity within the 6 feet. And again, you want to recommend 6 feet social distancing standard for any of your employees, but you just have to do kind of your own internal investigation when you're looking at quarantining. Ultimately, you need to keep your business operations moving forward, and doesn't mean you have to shut down your business and your office completely, especially if it's somebody that comes, for screening and you see the signs. Well, you just send them home. Take the appropriate precautions, and make sure even if people are in line, they're keeping that 6 foot physical distancing. And then again, if you notice that the employee is sick during the office hours or in the middle of the week, you just want to continue the employee education on PPE, continue the disinfection of the work areas, screening for all employees, guests and visitors. Just keep a consistent program in place in those situations. It's okay to be overcautious, and if that's something you need to do, do it. You just want to make sure that you're protecting you and your staff. The next slide really just provides an overview of types of workforces and what level of exposure they have relating to COVID-19. I know for a lot of our clients, they work in the healthcare industry, so when it comes to doing screening, I think the standard right now is 100.4 degrees. Well, maybe they'll look at it at a different level. Maybe they look at a lower temperature exposure. Maybe it's 99 degrees. But healthcare, emergency responders, first responders, anything involving medical, typically, they're going to have susceptible to maybe a higher exposure. So it's something to take into account. The medium exposure, basically, just where you're having large gatherings, where high schools, elementary schools, schools in general, but just higher population density work environments. But again, if you have that, that's where you maybe want to look at doing bi-weekly or having a rotational basis, where you have segmented groups come in to limit the amount of workforce. And a low exposure, just obviously workers who have minimal occupational contact. Maybe IT people that are maybe they work in the office setting, but they might be able to do the job directly from home. So we have 6 states right now, and this is getting into workers' comp. We have 6 states that have enacted legislation and creating a presumption of coverage for various types of workers. Those 6 states are Alaska, Minnesota, Utah, Wisconsin, where they limit the coverage to first responders and healthcare workers, but Illinois covers all essential workers, and Wyoming covers all workers. So 4 of those states have used that executive branch authority to implement this, whereas there are another 4 states like California, Kentucky that have taken executive action to provide coverage to other essential workers like grocery store employees. So when it comes to claims, and let's say you're just a regular office setting, it really is going to be a case-by-case basis still. It's not something, oh my God, I have an employee that caught COVID. If the employee calls you and it's over the weekend and he or she mentions, hey, I think I'm sick, I'm gonna go get tested. Well, ask them, oh, do you know how you got it? Like, oh, well, I went camping, or whatever the situation might be. This isn't something we necessarily have to immediately report to workers' comp. You're not a frontline business. So in Illinois, for instance, you don't want to necessarily solicit a COVID loss. It's going to be fluid. So however, if you have any type of doubts, though, and you just are not certain, that's when you would want to submit the claim and trust the guidance of your insurance carrier. And you'll let your adjuster conduct that investigation. When all else fails, reach out to your carrier, reach out, for guidance from your insurance from your carrier, from that adjuster to see, how you should proceed and get the claim. The worst thing that's going to happen is they investigate. And it should be noted that the NCCI is labeled COVID-19 as a catastrophic loss. So there would technically be no effect on your mod. Basically not a predictor of future performance. I can send that article through the NCCI that says it will not technically affect your mod. So it's just something to keep in mind as you navigate through this, and it's challenging. One thing you want to make sure of with Illinois is the presumption for certain workers who contract COVID-19. This is now enacted. The onus is on the employer and the carrier to determine, and this is for frontline workers, to determine that it was not work-related. Typically, the onus is on the employee, but they've changed it so the responsibility really is on the employer to determine if it was work-related. So it makes it a little bit more challenging in that front, but again, when all else fails, there's no harm in reporting the claim to your carrier and having them do an investigation to protect yourself. Okay. So there were questions that were submitted, and I want to kind of get that, so I'll address some of the questions. I will mention there was one of the questions was relating to if there was any case law, relating to EPLI, or at this point, there really isn't. I have not been able to identify any type of case law. It will develop, I'm sure, but that's something where I have not been able to identify any type of case law in this instance. Is obviously we're still this is really green for everybody, and we're still trying to navigate through. So that's something we're still trying to get a full understanding of, and it's going to be based on jurisdiction as well, especially with workers' compensation. Every state is handling it a little bit different. So when temperature checking employees before work, what is the protocol? If someone has a fever, is the company liable to test employees? So per the CDC, screening employees is optional. Screening or health checks they're not completely effective. So asymptomatic employees, individuals with mild, non-specific symptoms may not even realize they're infected, and guess what? They're going to pass through that screening. So, screening and health checks, they're not necessarily going to be a replacement for making sure you have social distancing, physical distancing, and wearing the appropriate PPE. But again, just encourage the self-screening prior to coming on site. Make sure the employees understand if they are sick, they need to notify you and don't come in. Quite simple. Employees, they should not come into work with a fever equal or higher to 100.4 degrees Fahrenheit. So that's something that they want to, mitigate themselves, take their own temperature. They're feeling warm. They can do that. If it's over 100.4, don't come in. Really, if it's over anything that seems uncomfortable, don't come in. And then under evaluation for COVID-19, again, just make sure that if they think they have COVID-19, they're under evaluation, please don't come in. I want to make sure that they have the results of the test before coming in. If they're already diagnosed and let's say, oh, it's been 2 weeks, you need to make sure that they're cleared by a medical professional before coming in. So we have to take those precautions. So when temperature checking, again, when temperature checking employees before work, what is the protocol? Someone has a fever, just additional things to look at. Fever is equal to 100.4 degrees, as mentioned. Under evaluation for COVID-19, lower temperature threshold may be used. One of the things you want to look at here when we talk about company, testing employees, you're not required to test employees. This is a way for you to screen. If you choose not to test, but you're doing all the other CDC guidelines, you shouldn't have concern for liability. You're going to remain on safe ground. This is really a fluid situation, and in the very beginning of COVID, they were saying face masks weren't necessarily the best things. Now we realize that face masks, facial protection is really important. But again, it's fluid. Research, science, it changes. So you just want to take the most proactive approach you can to keep you and your employees safe. And that doesn't mean, no, we have to do temperature checks. If you don't feel you're qualified to do temperature checks, don't conduct temperature checks. The other thing you can maybe look at would be to reach out to your local health agencies. You can hire from health clinics. You can hire professionals to do screenings. But you can, again, there are professionals that can assist, sometimes for a fee, sometimes there's options where they'll do it. If it's a community thing, sometimes some communities offer free testing at local employer organizations. It depends, but resources are critical, and if you can find resources or other professionals to help you, take advantage of it. So what precautions is the company required or encouraged to take before insisting employees return to an in-person event? I included the link for the CDC that I can also send directly. But it was previously discussed. Maintain your regular housekeeping practices, include routine cleaning and disinfecting of surfaces, equipment, make sure everything's, make sure that any equipment that is being operated, other elements of the work environment, make sure that you're staying consistent. When choosing cleaning chemicals, you should consult information from the EPA. So again, follow up with the Environmental Protection Agency when it comes to cleaning solutions, but just set the parameters to keep employees physically distanced. Make sure your employees have the appropriate PPE. Again, performing screenings before doing an in-person event, that's obviously a beneficial practice if you can do it. If you don't feel comfortable doing an in-person event, don't do the in-person event. This isn't something, if this is something you want to do, you can do it, but just follow the guidelines of the CDC. Make sure that you're taking all the appropriate precautions to help mitigate the exposure if somebody is symptomatic, or asymptomatic. Excuse me. All right, so what is recommended if my workplace has one incident of COVID in the office? What about multiple? Is it different? This is, already kind of touched on this, but in most cases, you do not need to shut down the facility. You just want to close off the areas for that prolonged period of time for the person that was involved in that area. If you can wait 24 hours before cleaning and disinfecting to minimize the potential exposure, do so. If you can't, just wait as long as you possibly can and take the precautions. If you have a hazmat suit and you want to really be careful, put it on to do the cleaning. But you just want to make sure if you want to hire the cleaning service, you have that cleaning service, those professionals, get them out there to take care and minimize that exposure. And again, employers just should inform employees of the possible COVID exposure in that workplace. Maintain the confidentiality and look at in that internal contract tracing to rule out the additional exposure. Okay. So what is recommended if my workplace has one incident of COVID? Okay, this is continued, my apologies. Work with the local health department officials, determine which employees had close contact. This is the stuff I already discussed. Workplaces need to follow the public health recommendations from the community-related exposure. So stay home for 14 days. If that employee is sick, make sure they're staying home for 14 days. Administer telework. If it comes to a point where there are a lot of folks that are potentially infected with the virus, you may want to send everybody home for telework again. You have that process in place, and a lot of times if you're just getting people back to the office, they already know the process to do telework. So make sure that your employees are self-monitoring for those symptoms. And if they're quarantined, make sure they're self-monitoring. If they have to get tested, while they're at home, have them go. They should go get tested. There's a guide here from the CDC again, where I can forward this link, but where the CDC can provides answers on this and how to monitor these types of workplace situations where there's multiple infections or infection in the workplace. So any type of additional guidance on COVID-19, I'm providing a link to your OSHA representative. I can, again, send this to you if you ask me. I'll be glad to send this over. But this will give you a full, this will actually provide a link to forward. Base will give you the whole opportunity to look through the entire nation for your local OSHA representative. So everybody should have a local OSHA representative, and there's no charge to reach out to your OSHA representative or to email them or ask questions. That's what they're there for. They will work with you. They'll help you. Non-for-profit organizations, they do provide consultation. They'll provide consultation regardless, but they'll do presentations for you. There's really a number of benefits to OSHA representatives, and they have a girth of knowledge. So definitely take advantage of reaching out to that OSHA representative, because he or she can really provide you with some great resources and really address some of your questions. The other thing is, this is a really nifty link that I want you to take a look at, where you can actually submit any health or safety related question directly to OSHA. They'll respond with a specific answer to your question. You would just use this link, input your information. I want to say it takes 5 to 10 days before they respond with an answer typically, but you can ask any question to OSHA relating to COVID-19 or safety, loss control, and it's really cool. They'll provide an answer for you. So it's just something that you want to take into account. So we have a little bit of time, but are there any questions that anybody might have that were submitted? Okay. Okay, so if not, thank you so much for joining me for the risk and safety in the time of COVID-19. And if you do have questions, I will be in contact with you. Reach out to me. You can always email me. My contact information is on the screen. I encourage you to follow Tandem HR on social media or our blog for any updated HR benefits and or safety information. So thank you so much, and don't hesitate to call, and have a great rest of your day.